Now also try to look at another, how will I put it? It's kind of like a consideration for the treatment of osteomyelitis. So debridement. So debridement is quite, straightforward. When you say you want to debride something, it simply means the tissues around that area has been dead. There's no amount of drugs or treatments that can bring those tissues back to life. If you leave those tissues, they will further affect the other good tissues there. So the best thing is what? You cut the dead tissues off so that when you give drugs, the tissues that are alive will better off respond to those drugs. So osteomyelitis, which is a bone infection, it leads to necrosis of the bone, that's sequestrum. So I always trying to cut out the dead bone so that the good bone could actually respond more to treatment. So debridement in osteomyelitis is a surgical procedure and is aimed at removing infected or dead bone. All right. So the surrounding unhealthy tissue to also control the infection, and you want to allow healing. Do you understand? Those are the primary reasons. What's the purpose of cutting off the dead tissues? Is to remove the dead tissue. So dead bone acts as a needles for persistent infection. See, the bacteria, they will house themselves in dead tissue. Now they will be released. The dead tissue is like their barrack, where they will be now be released from there to go and cause more harm to tissues that are alive. If you cut out the dead tissue, you reduce their base. So you can also drain abscess from there, prevent spread, reduce bacterial load, promote healing. So techniques. Use what's known as what? Sequestrectomy, curettage. Saucerization is reshaping the bone to create what? A shallow cavity for drainage. Also resection of the bone. Soft tissue management where you excise the sinus tract and all of that. So as you are cutting off the dead bone, you're also adding antibiotics, local antibiotics, systemic antibiotics, bone grafting or reconstruction, and also vacuum assisted closure. So it helps wound healing in complex cases and all of that.